February is Cancer Prevention Month, and recently I had the chance to sit down with a primary care physician to learn more about the things we can all do to reduce our risks of cancer and detect it early. I'm joined right now by Dr. Scott Joy, internal medicine physician from Englewood Primary Care out at Swedish Medical Center, and we're here to talk about cancer prevention. Dr. Joy, we want to talk about lifestyle choices right off the bat. Some cancers can be prevented by lifestyle choices. So what kind of changes should we be making in our lifestyles?
Yeah, great question, Jason. I think the biggest lifestyle change patients can make is to stop smoking. One of the biggest predictors of cancer is a smoking history, not only lung cancer, but colon cancer as well. So bladder cancer also can be associated with smoking. So I would say the biggest lifestyle opportunity for people out there who smoke, quitting smoking at any time is always a good idea for cancer prevention. Clearly, exercise can make a difference as well, just as simple as 30 minutes of walking 5 times a week. And clearly, a low-fat diet, a diet that's high in fruits and vegetables, is also a very good way to prevent cancer, particularly colon cancer.
Now, are there any types of cancer that we should be focused on specifically because we live here in Colorado?
Well, interestingly, in Colorado, with our sunny skies, skin cancer is a common concern. So clearly, people living in Colorado should be wearing their sunscreen often every time they're outside. We're mile high, and that increases our risk of skin cancers. And so, sunscreen is very important for cancer prevention in the high country of Colorado.
What about screenings? What are the most common screenings if people want to make sure that they are all in the clear? What type of things should people kind of point themselves towards?
Yeah, definitely. We think of big three: Pap smears for cervical cancer screening, mammograms for breast cancer screening, and colonoscopy for colon cancer screening. Have been some really nice advances in the last few years for colon cancer screening, particularly a new stool kit called Cologuard that is 92% effective at detecting early colon cancer. So if patients are reluctant to come in and have a procedure done and go under a conscious sedation to have that procedure done, if they don't have a personal history of polyps, if they don't have a family history of polyps, the Cologuard or the stool kit that we can mail directly to their house has been a very good a choice, and allows more people now to be screened for colon cancer to overcome that concern about the procedure.
All great information for people to keep in mind. Dr. Scott Joy, thank you so much for the time this morning.
Yep, thank you, Jason.
Well, along with our partners at the American Cancer Society, the Sarah Cannon Cancer Institute at Health One, the Cancer Support Community, and the Colorado Cancer Coalition, we've put together some resources for you if you have questions about cancer prevention. You can find it on the Your Health Matters page of thedenverchannel.com.